Welcome to the Lifestyle Herbalist Podcast. I'm Dabney Vaccaro, dental hygienist and clinical herbalist.
And I'm your co-host, Sabrina Cooper, a registered dental hygienist with a culinary nutritionist and herbalist, and a mindfulness and mindful eating coach.
Together, we explore the connection between oral health, nutrition, herbs, and whole body wellness, giving you practical ways to feel your very best. Grab yourself some tea and let's settle in. Hey, welcome back to the Lifestyle Herbalist. Sabrina and I are here to talk about all things dental hygiene today, and we're going to kind of lead you through a typical dental hygiene appointment. And have you ever wondered why your dental hygienist asks so many questions, measures around every tooth, examines your tongue and neck, or recommends dental x-rays when you think maybe nothing hurts? These steps may feel routine or perhaps even unnecessary when your mouth seems perfectly healthy, but they are doing something extremely important. They're helping us see that what cannot always be seen, notice changes before they become symptoms, and understand the bigger story your mouth may be telling us about your health. And today we're going to go behind the scenes of your dental hygiene appointment. We're going to talk about radiographs, periodontal evaluations, salivary testing, extraoral and intraoral examinations, which may be foreign terminology. These are the terminology things that we use here in the dental office. But extraoral is the outside area of your mouth, and intraoral is what's going on inside your mouth. And we're going to talk about medical history updates. These simply aren't just boxes that we check before cleaning your teeth. Together, they create a diagnostic picture that helps your dental team provide safer, more personalized, and preventive care.
Oh, this is exciting. You know, Dabney, I think we both have had a lot of patients, we were talking, that have brought up a lot of things like, why do we do this? Why do we do that? Why is it so important? I don't understand. Or so that's why we started this conversation. I think we talked about it, medical histories in the past, but this is where most times, if you go to your office, they're going to start the examination. So let's start with the part many people rush through. It's the medical history. So you might be thinking, like, nothing has changed, and I get this all the time. Has anything changed? No, nothing. And I think it's so important to really be truthful to your hygienist about what's happening, because even that small change in a vitamin or mineral that you're taking can maybe have an effect on your overall tissues, your mouth, your health. So we need to know that. So why does my dental hygienist need to know about these things? It has nothing to do with my teeth. That's a really good question we get a lot of times. But your mouth is part of your body. What affects one can often influence the other. And a medical history update helps us understand whether anything has changed that could affect your oral health, your healing response, or the safety of your treatment. We want to know about your new diagnoses, your surgeries, hospitalizations, allergies, maybe you're pregnant, changes in blood pressure, and new or discontinued medications. Even changes in vitamins, herbal products, or supplements can be relevant. So, Dabney, what's one of the things that you often get in the dental office of changes or medications that can affect certain things orally?
Well, as an herbalist and what I understand about herbal medicine, especially people who are taking blood thinners, when they're taking things like ginkgo or ginger or garlic, they can affect blood sugar, or I'm sorry, not blood sugar, blood thinning, blood anticoagulants as well. So people who are taking Plavix, or maybe they're not even on a blood thinning medication, but are taking things like garlic or ginkgo, those things can thin the blood and are important to understand, especially if they're having like an extraction doing or going on, or an implant or any kind of dental surgery. It's important to understand what's happening in the body so that we can be prepared in case there is a medical emergency, because we don't want a medical emergency. We want our patients coming in healthy. We want them to leave healthy. We don't
That's
want to
right.
call the rescue squad because somebody didn't tell us everything about their medical history, and now we have something like a medical crisis going on. So, things like syncope or what is that? Some people have hypertension. So we need to know if there's high blood pressure issues going on. If you're taking a high blood pressure medication, because we all know people sometimes get nervous about coming to the dental office. Their blood pressure might increase while they're at the dental office. And so if we're not ready for these things, it can be a bad day for everyone all the way around.
So true. And then there's that certain medications can cause us to see different things. Like if you're on medication for osteoporosis or cancer, it can influence how the jawbone is healing. Diabetes can affect body's inflammatory response. So the progression of periodontal disease and periodontal inflammation can also make blood sugar management more difficult. So we really want to be aware of these things if we see changes, because if when the time before you came and your mouth looked pretty healthy, everything was, stable, and the next time you come in and we see that there's a lot of inflammation and bleeding and everything's going on, and you've said, oh, no change, but failed to tell us that you're now on a diabetic medication or you're on some other, high blood pressure, maybe that's affecting the mouth as well. So we need to know this. And many medications can also reduce saliva production. They include certain antidepressants, antihistamines, blood pressure medication, pain medication, and drugs to treat anxiety or bladder conditions. So when the saliva decreases, the risk of cavities, oral irritation, fungal infections, difficulty swallowing, and bad breath may increase. So sometimes we get those questions like, why do I have bad breath all of a sudden? So if we're not asking these questions to be intrusive or to be nosy or to, we're looking for connections. We're looking to see that what is happening, why is X, Y, and Z is this, so this equals this, and then we figure it all out. So we just need to know because even when nothing has changed, confirming the information matters. Your medical history is not something completed once and then forgotten. It's a living part of your health record and your health history. So a small update can change the way we approach how we care for your teeth. And I know at my office, we do it every year. We do one hard copy on our computer. We like make sure everything is up to date. Every time we come into the office, we check that, new delete something, and then we make sure the hard copy is always right. The dentist I work for, fortunately, is very on top of everything, so she's always checking and double checking and posts here and posts here, so it's all over. We have red flags if you're on any medications, blood thinners, anything that needs a pre-medication. That's another thing. If you've had a surgery, a replacement or heart surgery or anything like that, we also need to know if you need pre-medication so that no bacteria is going into the bloodstream and all that stuff. So that's kind of it. Did I touch upon everything, or did you want to add anything?
Yeah, well,
I know there's a lot to talk
the
about.
other significant thing is that, well, and there's updates all the time. Like, I don't know about Canadian um, physicians, but here in the United States, there's been a change with antibiotics because there is such a problem with over subscriptions and overuse of
Right.
antibiotics that the new, I think, recommendation if you've had a replacement of a joint is that you just stay away from the dental office for 6 months and then
Yeah.
you never have to take an antibiotic, which is sounds good to me because I don't know. It just seems like uh, if you're out and about and you have an injury, and you're out in the woods and you cut yourself, like, are you going to take an antibiotic for that? Like, I know there's a certain thing about like dental and that sort of thing, but I don't know. I like the new standard that you don't have to take an antibiotic and you just stay away. Just make sure all your dental hygiene is caught up, that your dental things are done, and then you can just hopefully not have a tooth issue in the 6 months that you're healing from your joint replacement.
Yeah.
The other thing I,
We're kind of the same in that
oh,
we are, but there are still some, it varies. And that's the thing. Like
yes, it
some
does
surgeons will
vary.
say,
Mhm.
nope, I want you to take the pre-med. Some won't. So it's always, that's where our
Yes.
medical histories come in, where we need to know your doctors and all that. So we can cross-reference, check in and make sure that we're all on the same page because like
Yeah,
most things we always say, one thing works for one, it doesn't always work for the other. And it might
right.
be something was a little more serious than others. But we do keep people away from the dental office for 6 months. Just tell them to make sure they're kind of keeping up on their oral hygiene and things like that. They can always come in for a checkup just to make sure everything is
Yeah.
okay. But yeah, we don't do any deep scaling or any major work on
hmm
things like that. So
Yeah, the other thing to note though is that I have had patients, and one thing I've added to my own health history is like, when was the last time you were at the doctor? because a health history is great if they're
Yeah,
keeping up with their physical
agree.
appointments. But I've had patients who will say, "Oh, I haven't had blood work done in like 5 or 7 years." So, I mean, the health history is like, pfft, why bother then? I mean, we don't really know what's going on. But that's important information too, because then when we're looking in the mouth and we're noticing recession, we're noticing bleeding, we're noticing pocketing, that gives us clues of a pattern that might be happening. Like maybe it is time to go get blood work done, just to have a baseline. And I encourage my patients to go to the doctor, make an appointment, and just get a series of blood work done just so we can know that they don't have blood sugar issues or that they're not deficient in some way or that their white blood count is still in check. Because sometimes like things like cancer, it's going to show up. It's going to show up in the mouth as well with, chronic inflammation. So it's not always that you didn't brush well enough or that you're not cleaning in between your teeth well enough. Oftentimes it's a systemic issue. And so um, yeah, the health history is important if you go and good to know if you've been going to the doctor, but
Yep.
that's a good question to ask as well is when was your last appointment?
So true.
Hmm.
And medication. Sometimes you're like, I don't know what my medication is. Like, I'll bring it in next time, or, it keeps going and going and going. So, this also gives us a thing to check in as well to make sure that everything, people actually know what they're taking and why they're taking it. Sometimes they just take things and don't really know what they're for and what they're doing. So, it's a good
That is so
conversation
true.
good
Yeah,
conversation to have with patients as well, which, you were saying it's systemic, and this is why, again, we do the intra and oral, which we're going to probably move on to intra and oral, extra oral, and intraoral exams, which is inside the mouth and outside of the like your face and other things. So this is also what we do because it's looking beyond our medical history and the teeth. So before we even start, we do the extra oral, which includes looking at your face, lips, skin, and neck. We look at facial symmetry, swelling, changes in your skin color, lesions that don't seem to be healing. We also check and gently feel your neck for lymph nodes and surrounding tissues, your temporomandibular joints. So that's like your
mhm.
clicking up in your jaw bones to make sure there's no clicking, popping, and pain. And we'll ask questions if there is, if you've had headaches, difficulty opening. And then the muscles, check to see if you have really tight muscles and jaw tension, which can lead us to a conversation about grinding and clenching. Um, so, these are things if you're getting chipped teeth, all this kind of thing, muscle tenderness, morning headaches. So we really ask these questions as well. I'm just saying a quick overview and then we'll talk about it. But these are really important for us as well. Cracked lips even or ch like chapped lips or cracks in the corners of your lips, right? Like there's all these little signs and symptoms that can lead us to more questions.
Yeah, and the lower lip is a high probability of oral cancer, or yeah, of skin cancer. A lot of folks don't
Yeah.
think about putting sunscreen on their lips. And for farmers or people who work outside, a lot of times those changes around their lips are important. So those are some of the things that we are looking at when you're sitting back. So we take the health histories, we set your chair back, and then we're looking at uh, changes along your head and neck. Even looking at your like your scalp and your head, and for some folks who just maybe have thinning hair, is there a mole up there that looks a little funny? Is there something on your face that wasn't there, 3 weeks ago or 6 months ago? And certainly, we're not diagnosing. But then we can refer you to either an oral surgeon or your dermatologist to just have a look at it because cancer is one of those things you just don't want to play around with.
And the lymph nodes, especially like in your neck. I mean, it's not something that you go to the doctor for or that like that you can tell right away that something's going on. And we've actually had a few patients now that we've sent for referrals and have had like a thyroid cancer or
Mm,
something starting.
yeah.
And it was even a young person, 16 years old, that was just
Wow.
in, we thought it was just, let's go for a routine checkup. And it is something. So, we don't do it to make you panicked. We're doing, and don't ever feel like, oh my gosh, I probably have cancer. Or, oh, it's at me. It's just to follow up because we see it first. And again, doctors don't always look in these spots, right? You might not have any symptoms.
Mhm.
enlarge, right? So this is something that is on the outside that we feel. And
Yeah.
then we move on to the inside and check inside, and we can see sometimes, you know, what we see. Like,
Yeah. Well, another thing I wanted to add is that when those lymph nodes are swollen, typically I'll have my patient just put their hand on it so they can feel it
yeah,
themselves. And I was like, our body is very amazing. And so maybe you just have some sinuses. Maybe you have like an inner ear issue going on. Typically, our body is able to heal things within 2 weeks. And if this is still there after 2 weeks, I think you should go get an opinion from your doctor because your body's obviously fighting something that you might need some help with. So anyway, yeah,
yeah.
moving into the intraoral examination. This is where we're looking at the tissues of the mouth. Thank you for joining us today on the podcast. I wanted to pause and give a shout out to our sponsors. First, Great Ghee has become a favorite in my kitchen. I love having high quality, nourishing cooking fat made with simple ingredients and right here in Virginia. If you would like to try this yourself, use the link in the show notes and you'll receive 10% off your order with the code Dabney Vaccaro. We're also very grateful for Defender Shield. As we talk often about reducing our overall toxic burden, Defender Shield offers products designed to support healthier technology habits. Use the link in our show notes and receive 5% off your order. And finally, if you've been thinking about growing your own food, Survival Garden Seeds makes it easy to get started. Whether you have a large garden or a few containers on your porch, they're offering our listeners 10% off through the link in the show notes. Now let's get back to the show.
We're doing much more than searching for cavities because, inside the mouth, we took a quick glance, but this is more about the lips. We palpate cheeks, the inner cheeks, the gums, the tongue, the floor of the mouth, roof of the mouth, in the back of your throat. We're looking at the color, texture, shape, symmetry of tissues. We're watching for ulcers that haven't healed, unusual red or white areas, lumps, swelling, changes in pigmentation, signs of infection, or anything that looks different from their surrounding tissue that you might not notice. It's not very often that you probably go and check in your mouth and you brush your teeth and you out the door. So we ask you to move your tongue from side to side, lift it to the roof of your mouth. With our gloved hands, we palpate things to check that there's no lumps or bumps. Um, and most findings, like we said before, are not cancer, but they could be sores that are changing. They could be from trauma, infections, irritation, immune conditions, and other causes. But these little tactile things that we do, we're trained to look at things. We don't diagnose, but we mention it to the doctor. Again, we'll refer you. But it's important to understand that it's a screening tool. It's not a biopsy. It's not a definite diagnosis when something is concerning. We just, like I said, reassess, refer, note, and send you for additional testing to make sure. I mean, if it was me, I would rather get sent for testing and make sure it's not something major because things spread pretty quickly, as we all know, right? And so we really want to be on top of these things and we'll measure them and note them. Sometimes we take pictures and add them to your
Yes.
chart to make sure there's no changes from, appointment to appointment. And because, there's things that we know that can start looking kind of odd and lead to other things. But yeah, there's other things as well, Dabney, that you might want to talk about for about dry mouth and
Yeah.
acid infusion.
Wow. And, in the very beginning, we were asking about medical history, and almost every side effect of the medication is dry mouth. So if someone is on 2 or 3 blood pressure medications and they're also taking something else, you know, boy, that mouth, that terrain in there could be very dry. That then sets you up for a pretty high risk of getting cavities, gingivitis, and that sort of thing. So we are looking at the salivary flow. Saliva is so important. It's the liquid gold in our mouth. We're also looking at things like acid erosion. Um, acid reflux, digestive issues like this points to things like digestive things, and it might open up a conversation about like your digestion because as we said in the beginning, like our mouth is not separate, like it's all connected together. We're looking at areas of inflammation. Is your gums bleeding? Is there swollen? What's the recession like? Recession means your gums have shrunk down a little bit, and now we can see more of your tooth than we're supposed to. And we can see the root surfaces, which are not covered by enamel, and so they're more susceptible to things like cavities. We're also looking at tooth wear. Is that jaw tension and the palpation that we were doing in the beginning, is that leading to things like tooth wear? Has there been trauma? I've take pictures of people's mouths often who have had some type of trauma. They don't even remember what they did, but I can definitely tell, like, oh, it looks like you burned the roof of your mouth. And then when I think about it, it's like, oh yeah, I did have some hot coffee or I had some hot soup. But those are things to noteworthy or to note because, we want those things to disappear in about 10 to 14 days. We're also looking for areas of infection. Do you have pus coming out from under your gum? Do you have a sinus tract or a fistula that might be a failing root canal or maybe a tooth is infected? Oftentimes, if there's infection or like a fistula there, you will have no pain because the infection is coming out. Pain typically happens when there is pressure and the infection has not been able to find its way out. So we're looking at all of these things.
Yep,
Um,
cheek biting is a big one too. Like people who cheek bite can lead to like more extensive issues, cancers, etc. Also, there's tonsil stones if you're having bad breath or something, or weird taste in your mouth. We get look for tonsils, enlarged tonsils. Um, um, Tight frenums, which is like being tongue-tied, or lip pulling, which is maybe causing a separation in teeth in young kids. There's all these little things that we look at, not just okay, we're here to clean your teeth and bye-bye out the door. So next time your hygienist does this in like extensive 10, spends a lot of time on your medical history and intraoral and extra, be thankful that they're actually taking time to care about you and look and check in and make sure that all these things are okay because they're often overlooked.
yeah, these are just clues that we're looking
Yeah.
for. We're not making assumptions, we're not diagnosing, but we're just putting together the clues and the patterns of the mouth so that we can better understand what's going on to help our patients have better oral health outcomes. We all would love to end dental disease, right,
It's
Sabrina?
right. That would be ideal in an ideal world.
Right.
And that leads us to like a next quick, we'll just talk about periodontal evaluation, which is the probing that everybody or most patients don't really enjoy, I would say, getting poked by a little measurement type ruler that we use. I don't know how many times people are used to it in our office because we do it once a year. We make sure if there's something that we're watching, we'll check in every time and check that area. But we're very diligent about our periodontal evaluations, but there's the few that will say like, "Oh no, I don't need it. It's okay. I'm fine. Like I don't need it."
They don't want it.
They
That,
don't
that
want it's
they
because
don't
they don't
want it.
want
Yeah.
it. It's not that they don't need it, but they're telling
Right.
me that they
Right.
don't need it. And
Right.
sometimes we call out numbers if we have somebody helping us. A lot of times we don't, but they hear like the 2, 3, 4, 3, 2, 3, 3, 3. And so somebody's like, okay, so like the higher the number, the better, or the lower the number, the better. They still don't know, and they've had it done millions of times, like I don't know, through their life, and they're still not sure. So, what do the numbers mean? Um, we're basically measuring the depth of the sulcus, which is the deep part of the pocket around your tooth where you floss in between your gum and your tooth. And healthy measurements are shallow, like lower numbers, but the numbers don't tell the whole story. So we have to consider bleeding, gum recession, inflammation, attachment loss, mobility, if your tooth is moving, furcation involvement, which means that there's like the roots, you can get into the middle of the root, the back, it's mostly in the molars, of the multi-rooted tooth plaque, the tartar or calculus, the buildup levels, bone changes that are visible on radiographs. So these are things that all come into consideration when we do our probing. It's not just like, okay, the one might be a one, but then we have to also take into consideration if there's recession, if there's inflammation, what's happening, um, and the bleeding we take into consideration. So for probing and there's bleeding on probing, this is really important information because it lets us know that there's inflammation. We're not jabbing to make it bleed, but
Which
we're
is
not
what I've
like
been accused of. My gums weren't bleeding until you poked them.
yes. No, excuse me, I have clear my throat, but because they don't generally hurt. And people are like, but you hurt me and now they're bleeding. I'm like, but I just thought like I lightly touched it. And then it's like a gushing volcano of blood that we're like, okay, what's happening here, right? Like, because that's not normal. Your gums
Right.
should not be
And the
bleeding
perio
at any
charting shouldn't hurt.
point.
The perio charting on a healthy
Shouldn't hurt.
tissue, a healthy mouth does not hurt.
Right. And I was just going to say something.
And bleeding is an indication that there is inflammation. So
Right.
something's going on there. Maybe, I mean, it could be something just localized. Like maybe you had popcorn a couple nights ago and one of
Exactly.
those little holes are stuck down in there and then you fish it out and then things get better. Sometimes patients will actually traumatize their gums because they thought something felt like it was in there and they just go ham in there and just go crazy and actually cause trauma around the gum
Yep.
that will cause bleeding and that will cause it to be sore because you traumatized it. So, anyway, those are some
Yeah.
things that we look at. I mean, I've noticed how many times that people have cut themselves with floss because they just jammed it down in between their teeth. They hit their gum, they cut their gum. And yes, that's gonna hurt. That's trauma. So,
You're
finding a
not
way to
fooling
clean
us.
in between your teeth and flossing, I'm not a fan of flossing, mainly because I don't think people floss well. They don't do it correctly. And we just have a lot of concavities around our teeth. And the floss doesn't clean the biofilm or the bacteria and even all the food out from in
Mhm.
between the teeth. Because if you think about like people floss down, they
Yeah.
floss up. I mean, if you're pushing something in between your teeth, what food is going to come out in between your teeth? The food's going to be left in there. The floss is coming out, but it's not bringing food
No.
necessarily, unless you slide it around or swish around or something. Like there are so many better modalities to clean the in between the teeth than floss, but for some reason, our profession is stuck on it.
Yeah. I agree. I always like think like I get you have to look at each individual and yeah, there's just too many concavities, like you said, and too much that people just don't do it properly. And I feel like, well, they're doing something. It's better to do something than nothing at all, I suppose. But really, I agree. There's so many better things.
Hmm.
And people don't realize that periodontal disease is like a secret, and not it's a quiet disease sort of
Oh,
thing.
for
It's
sure.
often
Like blood
quiet.
pressure.
And you can have the inflammation, the attachment loss, changes in your bone without even having pain. Like it's just happening. That's why nothing hurts. So why do we have to do it? Doesn't always mean nothing is happening. So when we say like, let's just take, I always just say, can we just, let's try, like, I just want to check a few areas, which then I
Yeah.
kind of go around. And then they are like, oh, that wasn't so bad, you know? But because gum recession, the gum has moved down, the pocket measurement might not seem especially deep, but support may still have been lost. So you're losing that connection, right? Your tooth might eventually start slowly to become mobile or start moving. But combining the pocket depth with recession, we can better understand what the clinical attachment level is. So that means like how strong like is the attachment of your tooth to your tissues. We also check to see if there's mobility, bone loss. Yeah, I think I mentioned all of that. So we just do all of this so that we can have a map, a guideline for future appointments. So we
Mhm.
can see how tissues are responding to your treatment. Is the bleeding decreasing? Are the things that you're doing at home, the things we have suggested, are medications or anything causing more issues? Are the pocket depths stable? Is the recession progressing? Why is it progressing? Is it stable? And is a particular area becoming more difficult to maintain and why? So without these measurements, we would be relying just on appearance and not actually going deeper and seeing where the problems are coming up. And it helps transform um, your gums that look a little inflamed, and we can monitor over time.
Yeah, it's objective information so that we can
Yeah.
have a graft and we can look from time to time. So we save that periodontal chart in your dental chart, and we can look back through the years to see how things are moving. If are we moving in the right direction or are we moving in the wrong direction? If we're moving in the wrong direction, then it's a good time to pause, have a conversation, and maybe we need to talk about other things so that you don't lose your teeth. And one thing I always ask my patients, what are your goals? What are your goals for your mouth and your teeth? And we base things based on their goals and what they want. Um, and certainly periodontal disease is one thing that is, like Sabrina said, very quiet. I've had, sadly, I've had patients who have come into the dental office and who have never had a tooth issue in their mind. Nothing ever hurt. And they didn't come in until they noticed their tooth was mobile. And by the time that happens, it's very difficult to get things right and upright that ship because it's very difficult to get bone to grow back. There are certain ways, certain things and lasers, and I have seen it happen, but it happens very rarely in the mouth that bone actually grows back. And typically, when a tooth becomes mobile, depending on the mobility, the likelihood of that tooth lasting you the rest of your life is very, very low. So it's a progression over time that bone disintegrates, the bacteria load, the calculus that's kind of creeped up underneath the gum line. All of that is just a bacterial response, and your body is basically trying to get rid of your tooth because it doesn't want to keep that inflammation there. So it's our body's own immune system that's working to get rid of your tooth because it sees it as an infected area.
There you
Yeah.
have it. See, your mouth tells you more than you know, everyone. That's the whole point of our podcast is like really that, trust and know that your mouth is telling you things about overall systemic
And I
and
know it's hard to hear.
no,
And
it is hard to hear.
unfortunately, yeah, it's hard to hear. And, as hygienists, like we love making connections with our patients. We want to tell everybody, oh, you're doing great. Things look awesome. Have a good time. You're good for the next 6 months. But and it's hard to have those conversations with patients who are going like, what do you mean? What do I have to do now? And unfortunately, the reimbursement rate for dental is so low. Dental insurance is more like a coupon, at least here in America. Like very rarely does insurance cover much. And sadly, there is insurance company or patients who will just say, I just want to do what my insurance is going to cover. So sadly, that's not much. And what is your outcome? So if you want to keep your teeth, those things don't align up. So keeping my teeth, if I have disease based and what the insurance pays, it's not going to get you to your goal. So sadly, that's the reality. It's not like medical where so many things are covered in the medical offices. That's just
Right.
where we are with dental.
Well, and that leads us to the next topic is the radiographs. A lot of people, we get that. I hear it all the time. Like, how much do they cost? I don't have insurance. My insurance doesn't cover it, this, that, the other thing. So, but I'm often like, okay, maybe it's 25, I don't know, $30 now. I don't, for x-rays, two bite wings. I don't know. But I think like, what's that cost over time? It's not even a like cents per day, right? Over a course
Right.
of a year, but it's your health. And it's
Hmm.
going to prevent, if it's going to prevent something, it could prevent you from spending way more money out that you're not covered by insurance and getting like root canals, crowns, all that. So, really, when you think of a radiograph, next time you go to the office, think, hey, you know what? Maybe it's worth it. And where can I save $30 or $40 in my week to pay for these x-rays?
Hmm.
Right? Like I think I always think that like it drives me nuts. Like I think the priorities are kind of skewed when we come and then people think there's no point to them, but it helps us so much see the hidden things that we don't see. It's like
Oh,
when you go for an MRI, people are jumping at the fact to go, like here in Canada, you can get MRIs pretty much covered. It takes a while to get one, or like something when something's going wrong, or an X-ray. Everybody jumps on it. Oh yeah, I have a pain on my hip. Oh, X-ray, MRI, CT scan. But why don't you want to get a little X-ray on your tooth and see what's going on with your teeth to prevent something that may actually be happening, right? So, let's talk a little bit about that.
yeah. Uh, I was just thinking people sign up to go to get their mammograms. I
Yeah,
mean, that is a
prevention.
preventative screening.
Mhm.
This is what x-rays, a dental x-ray is a screening. We're looking in between the teeth. And I actually have pictures. I've done presentations on oral health before, but I actually have a patient. I took an intraoral photograph of his tooth uh, could not see any darkness at all. The teeth looked sound, it looked beautiful in his mouth, but on radiograph, there was a huge cavity in between the teeth. And had we not taken x-rays, that likely would have been missed during his checkup. And the unfortunate part of that is that we have something called a pulp chamber. The pulp chamber of the tooth is what gives the tooth vitality, gives it life. So when your tooth feels like sensitive or tender or cold, that's the pulp talking to you, and that's the vitality of the tooth. When decay reaches that pulp chamber, which is the living part of the tooth, it's going to become infected. Most people know, have heard about a root canal. That's usually what happens. When a tooth dies or when a cavity gets to that pulp chamber, then the tooth becomes symptomatic, and that's when you get pain. Part of this process with dental radiographs is to prevent people from getting pain, to prevent the cost of a root canal. Because if we could have just done a filling, then that is a fraction of the cost. Then, if you're going to decide to save your tooth and do a root canal, then you need a post inside your tooth to give it some strength. Then you need a crown over top of that. And you're looking at over $3,000 versus $250 for maybe a filling. So the point of the x-ray in saving your money for your $30 x-rays, you've saved no money now. Now you have pain,
Exactly.
and now you're paying a lot more to keep your tooth. So x-rays allow us to see areas during the clinical exam that we are unable to see visually. So while you're there, x-rays we take once a year typically, standard of care, and that's changing. It should be based on the need. So somebody who has a dry mouth, someone who's had cavities in the past, they're a higher risk. Do we need to take x-rays? Absolutely. Should we take x-rays? Absolutely. But
Yeah.
at the end of the day, it's the patient who gets to decide. We just document patient declined x-rays today. We explain their risks, we explain the things that could happen, but they decided not to take x-rays. The teeth are just tightly positioned beside one another, and we can't directly see in between them or even beneath the gum line. It gives us that probing and measurement gives us a baseline for pocket depths. But when we're looking at bone loss in general, sometimes the gums recede, and that recession is there, even though a number might be a 3. Bone loss, the clinical attachment loss, could be a lot greater, and it allows us to see year to year uh, how things are looking. And sometimes we can look back on an x-ray and see, there was actually no cavity there last year, but this year we have something going on. What has changed? And it opens up a communication then about, let's talk about what's causing your issue. Have you now started a soda pop addiction? Are you now do you have a cough and you now have like lozenges sitting in the lower right area because you have a dry mouth? Like something's changed, something's happened. So anyway, and
Yeah,
different
no.
radiographs provide different
Yep.
information.
So true. I was just
Yeah.
going to say that there's different ones. Like the bite wings that we talk about are the horizontal or vertical. Sometimes we do just if there's bone loss, vertical ones are like up and down, like they're um, x-ray is vertical and it gets a little bit more of the bone so we can see a little bit more. Most times we do the 2 bite wings or 4 bite wings just to check in between those teeth. They go far back, they're horizontal, they check for cavities most times that's what we're looking for. But then we have periapical x-rays, which are the ones that are specific to a specific area, and they show the whole crown and the root of your teeth plus the surrounding bone. So we can see when there's pain, swelling, trauma, deep cavity, some root canals. It lets us look at a greater picture. And then we have the panoramic x-ray, which is one that goes all the way around your head. As you walk into the machine, it spins, it kind of gives us the whole jaw picture. The surrounding structures, your TMJ, like we see a lot more there. I was just going to say there was another thing I was thinking, but now I forget. But the patterns of development, abnormalities. It doesn't, it's a broader picture, so it's not so the imaging is not focused, we're not focused on one specific spot. So we need the specific x-rays. We call them specific. Those other ones I just talked about are a little bit more specific. And those are something that are really important. And, because we not only see cavities, these dark areas on your teeth, but we also see things like infections starting, cyst-like areas, impacted teeth, root changes, bone loss, abnormalities that aren't always seen by our eyes. So when we do these, it's not just about finding cavities. It's taking everything that we've done, the extraoral, intraoral, going, okay, so we saw this on the periodontal evaluation. There was this deep pocket. The x-ray shows, yeah, it's clear. There's the bone loss. What's causing the bone loss? Is there maybe a cyst? Is there something in between the teeth? Is there a piece of calculus or tartar that's causing something to irritate? So this just gives us another layer of information that helps with diagnosis, risk assessment, and treatment planning so we can monitor a lot of the changes over time. So next time your dental hygienist says it's time for x-rays, don't cringe. I know they're not the funnest. We know we're not here to cause pain and make
Neither
you
is a
gag.
mammogram.
And we're not here to make you gag. We don't do it on purpose. We try our best to find solutions to make it easier. Everybody's like, you'd think nowadays that they would have a easier way to do x-rays, but I mean, now the x-rays are very like a lot of them are digital. I mean, I don't know very many people who aren't doing digital x-rays. But for the most part, they're thin. They're like a piece of paper.
Right. And so some folks are very nervous about the radiation concerns.
Yeah, that's another one.
Um,
That's
yeah,
another big.
yeah. So our goal isn't to take x-rays because you're due. Really, the goal is to gather information. So the like Sabrina said, those x-rays are digital, which they're very, very low. They're very sensitive these days. And so in Virginia, it's not even required to have a lid apron if you're using digital radiography. I still use it because they're in the room, so why not? Better be safe than sorry. But there is such a low radiation. You'll actually get more radiation sitting outside in the sun for a couple hours than you will for any digital x-rays that you're going to get in the dental office. So I know for years people were nervous about that, but we have technology now that allows us to do things that are much more safer. And for us, like we are in the dental office every day. Like we're around it every day. So I'm uber happy that there is less scatter radiation, there's less, so we're not getting exposed. So, I
Exactly.
mean, if you're nervous, I mean, think about us. We're there throughout the whole thing every day. So, anyway.
There's much more radiation. I always say, you use your cell phones by your ear, you're using technology, a lot of appliance things are, Wi-Fi, you have all this stuff. So you're surrounded by more radiation probably than the x-ray is actually causing you. So it's important. And again, we don't take x-rays just to take them. We take them with purpose. So we usually go by what is happening. We consider all these things before we take x-rays. If you've had a history of caries and cavities, like cavities, or you have, medications that are causing, we know could be causing some bone loss or periodontal disease. We may take them a little more often, maybe once a year as opposed to every 2 years, but it depends on the situation. So it's not because we're trying to like make more money. That's another one I get all the time.
Oh, yeah.
It's just the dentist wants more money from me to pay
Mhm.
for this or that. No, it's because we care and
Right.
we're not causing you harm. We're actually preventing harm.
Right.
Yeah.
And I have
So let's
had,
think about it that way, right? Let's think
yeah.
about it for a while. Just let that sit in that we're not causing harm. We're preventing it.
I've had over the course of my career, I have had four or five, maybe five, uh, different patients who we took a panoramic x-ray on that actually have cysts uh, going around. I mean, it was one of them was because they had their wisdom teeth and they were older and they were just sideways. And so the dentist, when they were younger, says, we'll just leave them unless it causes a problem. Well, guess what? It caused a problem. And then there was this huge cyst, and we actually sent them over to the oral surgeon. There was one she was 17 and she had a huge radiolucency along her lower jaw. And anyway, she ended up losing like part of her jaw. Like it was a major big deal. So these things, she had no pain. She had no symptoms whatsoever. It's just something that showed up on this x-ray. But it was pretty devastating to get that
Yeah.
information as a 17-year-old female that she's going to be having surgery and her jaw is going to be compromised from here on out. But, you know, we caught it to a point where it didn't progress and cause problems on like worse areas like her whole jaw. It was just a portion of the jaw.
Yeah.
So, there is a reason we do this.
And so like and I think, instead of us saying, when did you have your last x-rays, or let's check and see when your last x-rays were. Somebody says like, when were my last x-rays? When did I have them? Oh no, I swear I just had them last
Oh,
year and it's been
yeah,
like 3 years. I think a better question would be like, what information do we need today to care for you safely and effectively? And let's take it all into consideration. We'll check the dates and all that. But even if it was last year, but there was still something that we've been watching, let's do them today just to make sure that it's been a year since your last visit and we really want to make sure that everything is still okay, right?
right, right.
Because we get that too. Like, I swear I just had them last time.
Oh,
And you
yeah, I
look
hear
at
that all
their
the
chart and
time.
it's been 2 years because they've
Hmm.
refused x-ray every single time anyway. We could go on and about x-rays, but Dabney and I were talking about how we just feel that sometimes, people think it's just about a cleaning. Come in, get your teeth cleaned, but there's so much more to that we're doing. And I think that trust your hygienist, trust your dental team. They're there to help you and guide you. And yeah, and there's another thing that is now coming out. Dabney has more experience with this than I do. I don't have this special fancy machine, but salivary testing. And what saliva can tell you, because saliva can tell us a lot. I do know that, and we know that. But there are ways, and now more advancements that dental office are bringing in. So, Dabney, maybe you can talk a little bit about that
Oh,
because
I love it.
you are
I
familiar
am
with.
passionate about saliva. Saliva is our liquid gold. And when we have compromises in our health that reduces our liquid gold, we are compromised. Our saliva tells us a lot. I personally use a company that somebody spits into a tube and we mail it off. The thing I like about that is that it grafts the different types of strains that's in the mouth and what it can do systemically. So this one particular bacteria might be associated with cardiovascular disease. One particular one might be associated with digestive issues. These two together shows that this person's probably mouth breathing. This one might show that they have an oral appliance that maybe they're not getting clean enough. So it gives us again clues, it gives us patterns, and it opens up a way to ask questions. So it is a very important part of our mouth. It helps wash away food particles, it neutralizes acid, it supports swallowing, it protects our old tissues and supplies minerals that help repair early damage to tooth enamel. There are certain things like Sjogren's syndrome, where the parotid gland, which is the gland on either side of our cheek, 80% of the saliva comes from that parotid gland. And Sjogren's syndrome is um, a disease in which saliva doesn't come from the parotid gland. It's a syndrome, so it involves lots of different things. But at the end of the day, these particular patients have extremely dry mouth. Why is that important for us? Is because we want to then help them be able to have a better dental health outcome by perhaps providing them with nutritional counseling or giving them information of products that perhaps they can use that can help mitigate their dry mouth. Have you ever had such a dry mouth? I mean, a lot of us, when we get nervous, our mouth goes dry. It's really hard to talk. And if your mouth is dry, well, you're not going to be able to swallow your food very well. So when we evaluate saliva, we look at the flow, the consistency, the pH buffering capacity, and the test measures bacteria and biomarkers associated with oral conditions. I've had three patients who have showed up with really significant something called AA. AA is a very, very destructive bacteria, and scaling and brushing and flossing or whatever what modality you're using to clean in between your teeth, it's not going to touch this particular bacteria. And unless we treat it more aggressively, then likely the people who have AA will lose their teeth. That is just the destructive nature of this. It's not necessarily in the mouth, it's in the bloodstream. So the saliva, we're swallowing our saliva. Like we swallow a liter of saliva a day. And if we think that the bacteria in our mouth is staying there, it is not. It's getting through the rest of our body. So, understanding what compromises you have in your saliva can help us then understand the things that we can look for in the future in the rest of your body. For me, when I took my salivary test, I was high, not high, but I was at moderate risk for FA and FN. Those have been associated with colorectal cancer. That was a trigger for me because my family dies of cancer. So, okay, I have something in my mouth that could lead me to something like colorectal cancer. Here's some things that I can do for myself to get that number down so that it keeps me less likely to have that outcome. So the suggestion is that you get a baseline. I think everybody should have a baseline on their saliva. And then in 6 months or 1 year, maybe take another one to see if something has changed. Certainly, Sabrina and I have had patients over the past who were periodontal patients who were stable for a number of years, and then suddenly they were at risk again, or that inflammation occurred. What changed for them? Is the bacteria change? And the bacteria can change with something as easy as one medication changes. One medication change can alter the oral environment. I had a patient once who had very stable periodontal condition, and then he came in, and suddenly I wasn't treating him necessarily for periodontal issues. I was treating him for caries. He had one cavity after another. Every time he came in, he had one cavity after another, and he ended up with tooth loss. He ended up with more crowns until we got to the heart of it, which was his biomarkers. He had a lot more bacteria in his mouth that was causing that dental decay. And so we had to look at things differently for him. So anyway, the value comes from combining the test with the person sitting in front of us.
Yeah, it's so true. And it's definitely I think more offices should do the saliva testing, you know. It's definitely a beneficial test. Like it gives people something, a goal or something to, it's attainable, it's something, you know, that they can see and do, right? I think people, you could show them their x-ray and be like, oh, do you see this dark spot? And they'll be like, uh-huh. And I don't think they really do. Or I can tell them about their markers or periodontal evaluation. But I don't think it all sets in until they actually get some sort of a test result.
Hmm.
And
And
then
it's
that
nice to see that.
it becomes real, more real, I think, you know? Um,
And that's
because
what I try to tell them. It's like, this is you. This is your saliva. This is your test. This isn't just a blanket approach. We are looking at things just for you.
yeah,
And I think that's really what hits home.
yeah. And that's why putting all of the things, all these things together, pieces together. So for example, I'll just say, imagine a patient whose teeth look healthy. We have patients that come in, we're like, oh yeah, everything looks great. The updated medical, though, reveals a new medication that caused dry mouth. We look at the salivary assessment, it's showing a reduced flow, not like the test that Dabney's talking about, but we notice that there's less saliva flow. We take the bite wing x-rays and we see that there's decay happening in the two back teeth. And then the periodontal evaluation shows some bleeding, a few deeper areas that the patient didn't know were there. And none of these findings tells the complete story on its own, but together they show us that this patient's risk has changed. It's not stable anymore. Like there's something that's changing.
Mhm.
So may benefit from a different recall interval. So that might be maybe they're on a 6 month, maybe we have them come in 3 months to check in and make sure nothing is progressing because things in the mouth happen pretty quickly depending where they are. Maybe it's a targeted fluoride treatment, you know, something that we can suggest or provide. Some dry mouth support, dietary guidance, information about the medications they're taking that maybe they didn't know, you know, they didn't realize. And improved interdental cleaning. So we clean a little, you know, in depth, maybe focusing on specific areas. Maybe it's doing things with anesthetic because there's something a little deeper that we didn't catch the last time. And just doing some closer monitoring because, you know, this is why we do the things we do, right? We just have to change and pivot a treatment because maybe what was working in the past now has shifted because of that medication or the change in dietary or, you know, whatever it is. So um, it's not just about the cleaning. It's the comprehensive care. It's us listening, observing, measuring, imaging, and then when necessary, and documenting and connecting the findings so that we can provide better care.
Yeah. Yeah, and you might wonder why these examinations need to be repeated when everything was normal last time. And the answer is really pretty simple. Our health changes. I wish things would stay the same. I wish I could be as healthy as I was when I was, 16 years old, but unfortunately, life happens.
Yeah.
Medications change, stress changes, hormones change, saliva changes. Medical conditions develop in just, old restorations. Gum disease can progress, the tissue abnormalities can appear between visits. And repeating these assessments allows us to establish our trend. And we're looking at trends, we're looking at patterns. One isolated measurement may not mean very much, but a pattern developing over several appointments can be very significant. Good dental records create a timeline for your oral health. They allow us to recognize stability. We can celebrate improvements when things go well. Like I have had patients who give me high vibes, like, yeah, things are looking better. And we can respond when something begins to change.
Yeah. And it's, do you find it interesting? I find it very interesting that patients who are very gung-ho about their dental care, there's ones that are like A plus patients. They
Oh,
do
sure.
everything right. Like they just are blessed to have great oral health. They drink their water, they're exercising, they're eating right. And usually, generally, they don't have major issues. But then the ones that are like not wanting to come to the dentist or are having all the issues are the ones that will let their appointments go longer. And then, I always sit down with them and I'll say, if I know you're nervous or hesitant, or you don't want to come in for whatever reason to get your teeth cleaned, but if you came in more often, you wouldn't have to be so stressed out and nervous and have to deal with all the issues and the pain and the poking every time because you'd be more consistent and you'd
Right.
have less issues.
Right.
So I know if you're afraid, talk to us. Tell us you're nervous. We can help you. Maybe it is doing stuff, doing a cleaning with a little bit of anesthetic and you get one poke, you're a little frozen and for I don't know what you like numb.
Mhm.
And then you are okay though, but then we can clean and you won't feel pokey every and you're not cringing and making us feel like, oh gosh, I feel so bad. I don't want to hurt this patient, but we need to get in there and we can't do our job properly. So the things we suggest are to make life easier on you and on us, and so that you will give us high fives 6 months later and be like, yes, it was awesome. My teeth are so much better now. I feel great and I'm doing all the right things. So next time, just know that we care when we do all the things we do. You cleaning and removing plaque and calculus is part of the help at home and eating healthy and drinking your water and following some of the things that we tell you. Maybe sometimes it gets a little hard. I get it. Life gets busy, but always try and put that first. I mean, we put everything else first, exercise, et cetera, et cetera. So why not give yourself that 5 minutes at the end of the day, at the beginning of the day to do your oral health care routine? It's not long. It
Yeah,
really is
it is a
long.
routine
It's
too.
a
And the
routine.
more the more consistent you are, the more likely you'll get it done. Like I
Right.
physically, I cannot go to bed unless I brush my teeth. I,
No,
I
I
can't
feel
do it.
like
I just
grungy.
I just can't.
Me
I
neither.
just can't.
I can't either.
No.
And it's not that your mouth is separate from the rest of your body. Your mouth is the first part of where food goes in. It's helps you chew. It helps you live. It's like everything works together
It's
with
the
your mouth.
gateway for
It's
the
the
rest of the
gateway.
body.
Exactly. So
Hmm.
we really need to like focus on that. Know that without your teeth, what happens? Then and trust me, you don't want to be like, oh, it's okay if I need to get a denture. No, because
It just
dentures.
gives you another set of problems. Everybody thinks, oh,
Exactly.
well,
It's it's
I want to be done
fine.
with problems. No, you're just
No,
going to get a different set.
a different set of problems, crowns, bridges, all that comes with a different set. And if you're really not wanting to floss and take care of your teeth with your regular set, your healthy set of teeth, you're not going to want to do it when you have to put floss threaders in and do this and do that. And it's not going
The
to be a fun
funniest
thing.
thing happened. This man asked me, he broke off a tooth and he says, well, if I put a crown, is it going to last me forever? And I was like, you broke what God gave you. Do you think we're going to be able to make something that's going to last forever? Really?
I know. I know.
I don't think so.
No. So tell us when something changes. Ask us what we're measuring. Ask us why an image is being recommended. Ask us the questions. Ask what we found. Ask what you can do with that information. Because when you understand the why behind your dental appointment and your dental care, you become the active participant in protecting not only your smile, but your overall health. And that's what we want. And that was the whole point of our podcast today, that it's wanting you to take time to take care of your smile and prevent issues from happening. So until next time, we say stay curious, stay proactive. Remember that prevention begins with paying attention. And Dabney, do you have anything else in closing?
Uh, Ask questions. Be an active participant in your health care. Don't just sit there and say aha and zone out. Ask questions. What are you noticing today? What are you seeing with my gums? Or do you see any issues today? When was the last time I had x-rays? Ask questions. We love it when
Mhm.
patients become active in their own care because it makes me think, okay, maybe they're actually going to make a real change. Maybe there'll actually be something different next time. That's what I want to say. Be active participant.
Yeah, I
All
love
right.
it. Anyway, until
All right.
next time,
Until next time.
share this with anybody who needs a little motivation to get going to the dentist and
Yeah.
taking care of their oral
Keep
health.
smiling. Keep
Keep
smiling.
smiling.
All
Healthy dose
right.
of happiness.
That's right. That's right.